right. So, welcome to episode 9 of the Athena MD podcast. Again, that's because Athena is the patron goddess of heroic endeavors, which is what I feel like it basically takes for weight loss sometimes. But this will be episode 9 where we're going to talk about maintenance. And so, again, like the past several episodes have really been, hopefully to give primarily patients and things like really like a reference. If we are over the first visit, really talking about sort of, physiology and metabolic adaptation and these things, and then really kind of trying to build on that with, nutrition and exercise and all of these sort of layer cake. Eventually, we will kind of get into a long phase of, seeing you, usually every other month while losing and really troubleshooting and revisiting this along the way, going through plateaus over and over again, adjusting meds, dealing with challenges as they arise, right? But eventually, right, we get to goal, whatever that goal was, whether that's, yours or weight or, with the body composition scanning, if we just wanted to normalize visceral fat. Actually, I had a patient yesterday. Oh, it was so exciting. It was 5. She's been working on this 5 months. And her visceral fat went from, I think it was 4.4 liters down to 0.8, which is amazing. And so the rest, as I like to say, is like gravy. Like you've fixed the health problem. But what's funny is a lot of times we'll say at the beginning of a weight loss journey, especially if it's someone that we're just seeing, or I'm just seeing for weight, I'd say, this first 3 months about, kind of monthly and then kind of spacing out to every other month. But when we get to that goal, maintenance, I actually do recommend the first year of maintenance, touching base at least quarterly. And that is because, we have okay data on a lot of aspects of maintenance. And certainly we understand like the habits and things. However, also as the patient side, I feel that maintenance can be one of the most emotionally fragile times. It feels like everything's going to break and just like evaporate. And it can be a kind of, really rough because so much of the weight loss journey is so, structured and directed and goal oriented. And you get to a point where you know what to do, right? Like, it's like, look, I, always engage in surveillance weighing. I'm always doing mindful intuitive eating. Okay. If I hit a pause, what do? I mentally check in. Okay. There's no explanation, right? I haven't recently taken a trip or, I had some stress or whatever. Okay. Well, then I'm, tracking dispassionately looking for, okay, is, one of those 4 variables of food. Okay. If that's all right, then that's the caveman in the brainstem, adjust medications. And we move on and we've been kind of going through this flow chart, in pattern and, dealing with things and adjusting things as we move along. And then we get to the day, right? And what I find really interesting about sort of when we first get to, a maintenance appointment. So MIM, right? Metabolic and maintenance. That's what I would title the note. But as far as the type of visit, the first thing I'm going to ask is because we would have set this goal from the beginning and I'm giving you a little piece of paper every visit that has kind of our whole, kind of history and stuff. And so the first question I'm going to ask is, okay, is this maintenance? Because, really from my perspective, a couple things, I think as the patient, a lot of times there is such fear and such a thought that this can't really happen. I don't know if it'll really work for me. I think sometimes people pick not overly conservative, but they pick sort of whatever the goal is, not with an idea of what they really want, but with what I would settle for or be okay with, right? And so what's interesting about this time is sort of the thought process of, okay, we got here, is this maintenance? Because I would have, for many patients, just as I did for myself, set a goal of okay, Look, we've got good data on a BMI of 30 or above. We understand that that is the number, at least for Caucasians, that raises lifetime risk of diabetes. Okay, so once we're into overweight, do we need to go further? If we've got a body composition scan and the visceral adipose tissue is low, health risks are low. Do we need to change? So to me, it's like, get rid of the health risk and everything after that is gravy. One very adorable patient one time said, but I want some gravy, which is great. And like happy to do that. But this is all about like, what do you want? And I feel like so many times as the patient and as women and just in this like firestorm of what our society is and the level of noise there, like not just food noise, but, cultural expectations, just what it is to be a woman and, where this intersects with like health, but perceptions of attractiveness and all these things. There's such a noise. I cannot tell you how many times I ask a patient, so what is your goal? And a paragraph ensues. And I'm like, okay, it's just okay. But, and a lot of times I will say, okay, what do you want? Like, what do you forget everyone else? Forget like, what do you want? If you, think back to that time and like, what do you want? Do you want to get up off the couch at night and not have it hurt? I hated that. I really thought I would end up with a hip replacement before I was 50. Do you want to not be hiding like in the back of pictures? What do you want? Do you have it? Like, are you there? And if you are, like, cool, like, who cares? Like, we're done, are we? And so, I think, the first question is really like, okay, like, is this maintenance? And I would say, okay, great. But then like our goal is going to shift. And this is a bumpy shift because again, everything was so driven and you got feedback every day. I also have been thinking lately, if I could envision a scale, it would be an electronic scale and it would only display an arrow, actually, not a weight. Sometimes I think this might be good for patients and it would either be flat or up or down, but now we're looking for the flat, right? Except for, is it really flat? Like, no. And so this is the whole other thing we have to learn like all over again. And for every little ounce of effort it took with regular surveillance weighing to get over that like sting and panic and happiness and, all of that to begin to see it as a piece of data, now something different happens, right? Because it's not the progression. It's not the downward arrow, but like the arrow's never really that stable, is it? When patients sometimes will get upset about things, I will actually assign as homework sometimes to go home and weigh yourself the last thing you do before you get into bed, and then to weigh yourself first thing in the morning. And that number will be like 2 pounds different, right? Like the concept that we are even the same weight, moment to moment, it's not true. And so this is where we have to learn to become comfortable with the waggle. And like all of that learning was worth something, right? And so we've got to understand there is a natural like a variation like day to day. And this line is not perfect straight. Nobody has a weight. You've got like, generally like a range, but like, any measurement is just what it was at that point in time. And so part of the sort of psychological discomfort of maintenance is that number is going to change and it's going to change a lot. And so we have to really set goals. So recommendations are actually for maintenance to be within a 3% range. I will say in practical practice, this almost always works out to like 5-ish pounds. Cause let's say that, if, someone's kind of picking like 140s, right. Or even 130s. Okay. Well, 3% of 140. So you've got like the 1.4 times 3. So that'd be 3, 4. So that'd be 4.2, right? 1.3. If you're in the 130s, 3% of 130 is 3 point. So it's 3.9, 4.2. And so it really is in this sort of almost always like a 3 to 5 pound range, right? High threes, because even like 120s is going to be 3.6. So it really is almost always that we're going to look at Like, what is our home range? And that's like the first kind of thing we'll try to establish is just, number one, is this maintenance? Is this what we want? Do we dare to hope for more? And we want to keep, okay, fine. And I like care zero. It's what you want, right? As long as health, and everything is okay. And so sometimes we adjust goals, but more often we're saying, okay, so let's talk about our range. And I will say, recommendations are about a 3% range. And so I'll work that out for them. And then I'll kind of say, okay, so we're going to call whatever, like this is our range. And so I will do that kind of 3% up, 3% down. So realistic, a lot of times this will generally not quite work out to a 10-pound range, but it's close. And so why are we going to establish this? Because you have to learn to let go and understand that it's okay for life to happen, right? It will. We are all actually human. Nothing is perfect. And so there's going to be some day-to-day variation. So we want to learn to recognize that. And we're totally cool within this range, right? So if you are at 145, right? And so you're basically going to be the 140s are your homeland, right? And so we're okay, anywhere in there, right? And so, occasionally if someone wants to use a lot, we will have if they want to lose a lot more, we will have conversations hey, as a female, if we get, BMI 22 and under, that's where we begin to have concerns about bone density. I'm not saying that you can't be there or that this would be unhealthy, but you should be aware of the risk, and we're going to have to be extra diligent about adequate protein intake, collagen intake, resistance training, weight bearing exercise, that kind of thing. Okay. So all that to say, we will discuss goals, and then we're going to establish a maintenance range. And if this is kind of what we want. Okay. I do generally tend to talk a lot in maintenance and check in about, how are we eating? What is our maintenance strategy, right? And this is all along the way. I think if there's one theme in my practice is very I can give you all the evidence supported things, but good, better, best, perfect is not generally the happiest way for living. And I will always say from the beginning, everything we do, we've got to be able to do forever. And so we will also talk about, kind of strategies as far as how are we going to deal with this, especially when we approach the holidays, if people want to go out for dinner, and we'll kind of review those things. As far as, social realities, a lot of times, I do try to check in and say, because honestly, realistically, as females, relationships a lot of times can change through a weight loss journey. And it's a very odd thing, in society. It's so strange. And I reflect on this a lot because sometimes it feels like everyone judges you and, says all these things and makes life so difficult for you when you are of size or carrying extra weight. And then it's if we go to take action about it, now there's this, what? Oh, you're cheating? What? It's honestly, it's very confusing. I feel like what do people want? If you try to fix it, and then, and so I will say, and I will encourage a lot of people kind of from the beginning, be careful who you share with, know, if they are a real friend and going to be supportive and that kind of thing. But also by the same token, if you do find those people who are also struggling along the way, I think there's great power in sharing your own story and opening up and helping other people get help. I mean, you have a tremendous font of knowledge if you've been through this on your own, and you can really help a lot of people. And so, I generally will also try to, address as we go into maintenance that the thing is, as far as people who are engaging in surveillance weighing over the long term, the first year of maintenance is often not really maintenance. And this happens for so many patients. And that's because, what we tend to intellectually or obviously realize as loss, it generally has to be about 1 pound a week. That is the threshold at which, if you're weighing regularly, you're going to notice the numbers kind of consistently changing in downward trend. This is not to say that you're not successfully losing if it's at a rate lower than that. You're just not going to notice that. And so I am the poster queen of this in that, I would argue with people actually. 2023 was probably first when, I had been in Lubbock about a year and in maintenance, for a year. But the thing is, if you have a diet and lifestyle and habits set up that you are, happy with, you may continue to trend down rather significantly. And so I will warn also patients about this. This is where I say, hold off on big purchases. So also the poster child here, because when I got to size 12, if you're a male listening to this, just be aware, more than half of American women wear a size larger than 14. But that is typically the highest size sold in most retail outlets. Judgment and shame for these people. That's totally disgusting as a society. But yet here's where we are. However, I was pretty stoked when I could actually go and shop at I don't want to say a real store, but that felt amazing. It was wild, right? Oh no. So I 100% got a pair of very expensive, very pretty wool plaid trousers, in a size 12, which is no longer my size. So this is where I will gently caution, because you deserve everything in the world and everything, to celebrate this new place where we are in maintenance. And this is the new us that we have been slowly evolving out of the shell over the past year or more. But I would beware large purchases, because realistically, if you have established a healthy practice, right, this is the way we live our lives now, that weight will and body composition will continue to shift. And so two things. Number one, size will typically continue to change, not insignificantly over the next year or so, even in maintenance, even with not out changing things, and weight may as well. Much more commonly for a composition to change, even if the weight does. And so size then can change. And so, I advise, but I think most of us probably get out and get a little something because we're excited. But okay, so anyway, we're going to want to establish our maintenance range. We're going to talk a little bit about, those realities. Yes, we are in maintenance if that's what we have established and agreed upon together, but we realize this may continue to drift and evolve, and that's okay. You have learned how to feed your body in a healthy fashion to nourish it, with the protein that it needs every day, the exercise it needs every day. And so, your body may just continue to drift to a weight that it wants, and that may continue to evolve over time. Okay. This is the point where a lot of times as we're having those kind of quarterly, visits and maintenance, I will sometimes address again about the holidays. Are we beginning to, talk about these things? Because I think that, a lot of times, early in the process, it feels so hesitant that, I will tell a lot of people on your first year of loss, the first holidays, do not engage. Just don't argue. It's not worth engaging, right? At the family holiday. I think as you approach really what we learn kind of that second year of maintenance is that, or the first year, when you go from year 0 to you complete your first year and then entering your second year of maintenance. The second year is when people really begin to get some confidence, in that, it's not going to break, right? So that first year of maintenance, it is not uncommon to be very, very scared. I will talk about, meds, with patients. And as with all things in my practice, this is determined by you, your physiology, and what works. And so I think a lot of us have a desire to see can I live free, without meds? Great. Let's explore, right? However, many of us also have an intense emotional attachment to however we lost. And that's okay too. No one is sitting there watching. I'm certainly not. Who cares? So you do you. And, the world is your oyster. I mean, certainly I also talk with patients all the time. When we talk about meds, it's okay, a lot of these meds have health benefits. We prescribe to treat fatty liver, to reduce cardiac risk long-term. And so there's technically no reason to stop these, right? If nothing else is going on, we're not, needing to stop them because you want to try and get pregnant or whatever that is. there's no reason to stop it. And so I would say, first, let's be calm, leave everything the same. Second, learn your rhythm, right? The slow, and you begin to learn the up and down, and then also begin to relax. Okay. I actually told someone this morning. It's just the way that she was talking about food was just a little, and I'm like, okay, but food is not the enemy. Food is to be enjoyed, right? Like, so I was giving advice for the holidays, and I'm like, put a little of everything on your plate. And yes, we're going to be focusing on mindful eating. There is, and I'm just going to say this for the holidays as well, there's nothing you can do in one day that is going to change your story for the remaining 364 days of the year. Stop. Who cares? Yeah. So that day is definitely not a lost day. And you want to just be enjoying and realizing that, food is and has never been the enemy, but at the same time, it's more than like food. It's okay to savor this, to enjoy it, to let it be a little bit of a celebration. And then we pull back to our regular, right? So I really encourage, a little okay, begin to loosen up. Okay, if we're going on a trip, is this are we going to just be in the moment? Who cares? Don't think about tracking. Enjoy. Listen to your body, right? We can fix this all when we come back. And if there's one overarching theme I could say about, that first year of maintenance is this sort of transition from I am abject terror. I need all of my things and the routine cannot change. And I will keep, to these little baby steps out to find yeah, we're going to go to Mexico for a week. It's going to be fine. If I come back a little heavier, I know that I just get back on track. And that is really sort of the key that we will sort of review almost every time in a maintenance visit is going to be, hey, number one, you've lost this amount. Hey, we're still in our, maintenance range. Great. Okay, we're sticking to our habits. We still have a form of exercise we like because remember, we'll talk about metabolic adaptation. We definitely have that if we've lost more than 10%. So out of respect for the disease, which we still have and will forever, we're still engaging in, regular surveillance weighing, mindful and intuitive eating. If all of that is going great and we're in our maintenance range, who cares, right? If we find that we're ticking up or we get back out of a trip, I think of it kind of like a little mental flow chart, right? Okay, we assess. Did I just get back from a trip? Was it the holiday? Okay, give yourself some break. Get back on habits and see, hey, am I returning, into my little range? If not, okay, great. Dispassionately track for a few days. Okay. And if not, then, we're on the horn. But I also reassure, I am an obesity medicine physician. You have, obesity. Okay, great. You have access to meds 100% without question from me for the rest of your life. Okay. And always we are mindful. We'll also talk about, hey, remember those 3 steps we talked about way at the beginning, hungry brain, right? If stress pops up, maybe in a season we'll need a medication for that, right? A lot of patients, if they want to know if we can get rid of all meds, which I am totally for if we can. Okay, so we experiment, right? Peel something back. How did we do? Do we need more? Do we need to check an insulin level and see where that's at? That's perfectly fine. And so everyone's maintenance is going to look a little bit different. For me personally, what I, primarily take for maintenance is just metformin. For whatever, I just probably carried weight long enough that sugars are just really not super stable and without it. And I just find that I'm way hungrier. And so that's me, not necessarily you. It's not a rule for anyone else. And I think it's great. If you want a more data-based, sure, decision maker, great. And slap a glucose monitor on you and check. I mean, there's so many ways and pieces of technology now to figure this out. But, I would say always be open to, everything. And, we would aim to accomplish whatever you want, if that's living without meds or pulse dosing is something we talk about, taking, a dose every so often, when we feel like we need it. And that's perfectly fine too. There is nothing wrong with any choice. And so we kind of go over that and periodically check in. We do, I do always encourage, respect the disease. We never stop looking. We never forget where we came from. And we never don't love ourselves enough to to keep looking, right? Because it's just, I want you to know and take intervention if there's a gain like of, 5 pounds, not like I was ashamed and there shouldn't be any shame. Oh, it's a disease. But when I gained, like 20 pounds just because I didn't look, and that's what we want to prevent from happening. And so whatever that kind of surveillance looks like for you, fine. My job is to supply you with the data. Data is at least 2 out of every 3 days, but if something else is working for you, then it works for you. I do think it's great to, continue to, always reassess. If there's one, kind of constant theme ongoing, and that we hit that first year of maintenance is also like reassessment. If your body tells you faithfully on the scale, is what we're doing the right answer? If it's not, no muss, no fuss, no argument, no shame. You just try different stuff. And overall, like that's kind of what we continuously try to check in on. And then gradually we feel like a little bit more confident. And I would say really year 2 is where, it's like, okay, yeah, it's going to be fine, because what feels like a tragedy year of 1 of maintenance, like a little bit of gain, which is fine. In year 2 is when I think most people will begin to believe, that, hey, it's going to be okay. I really do. I've got this. But yes, primary theme of first year is, look, we were all traumatized by our society intensely for a long time, like about this, super judged, probably not treated great, often discounted in healthcare settings, and basically always made to feel like everything was your fault because of your size, right? Takes a while for that sort of to seep out and for like you to trust you. And so I just, continually advocate, tell yourself, right, over and over again, like this is a disease. If you look at the physiologic underpinnings, it is a freaking miracle that anyone can lose weight and certainly that they can maintain. So like you're a rock star. You're a rock star if you just don't gain, right? Because the average person gains every year of their adult life. But, if you're able to like even maintain and like this, it's like amazing. And so to really enjoy that and to hopefully begin to like kind of relax over time, begin to enjoy things a little bit more and just like have a better perspective as we go. And so those are kind of the things we talk about, definitely that first maintenance visit and then sort of as an ongoing theme. And so if that's where you're at, congrats, like never stop like celebrating or like remembering what you've done. I think it's great to like pick, maybe we should all do like, I don't know, a maintenance anniversary or like whatever month like you think you started, and just like remember it is a tremendous accomplishment. You beat the caveman in your brainstem. Awesome. Right. And so if you have been successful, definitely like share your story, like when you feel ready, tell others. And I think the more that we can do to like share that and just, destigmatize and just, be open to like, there's so many ways. There is no one right anything, for everyone, and just be kind to each other. And so that is what I would recommend. And so congrats if you've been through that. Definitely share your story and definitely, look for other goals. I think that's really what we're all missing in maintenance. Got to set another goal because you were working so hard for this for so long. So even if I missed this year because I have this horrible bum left shoulder, I want to be able to do a pull up. Maybe 2026 will be my year. So anyway, set a goal. And if you like what you've heard, follow and subscribe. And then we will see you next time for then pulling it all together.